None of the videos published on this channel are intended to promote or encourage illegal activities. All content is carefully prepared using publicly available information sources and visual materials.
On the morning of September 29, 1982, in a quiet suburban neighborhood of Chicago, a seemingly ordinary day turned into a nightmare. 12-year-old Mary Kellerman woke up with a mild headache. Her parents, like any concerned family, gave her a Tylenol capsule to ease the discomfort. What they didn't know was that this small act of care would be their last memory of their daughter alive. Just hours later, Mary collapsed, and despite desperate efforts to save her, she tragically passed away. Unbeknownst to the Kellerman family, this was only the beginning of a horrifying series of events. That same day, across the city, several other people suddenly fell ill and died. The common link? Each had recently taken Tylenol. Panic quickly set in as news spread that what was thought to be a simple pain reliever was now suspected to be a deadly poison. As emergency rooms filled with patients experiencing similar symptoms, medical professionals scrambled to understand what was happening. Initial tests revealed a terrifying discovery. The deaths were caused by cyanide poisoning. The police were alerted, and it wasn't long before they realized that the source of the cyanide was Tylenol capsules that had been tampered with. Someone had injected lethal doses of cyanide into the capsules, turning a trusted household medication into a murder weapon. The news sent shockwaves across the nation. Families rushed to check their medicine cabinets, and fear gripped communities as they wondered who could be behind such a heinous act. Johnson & Johnson, the company that manufactured Tylenol, immediately initiated a massive recall, pulling millions of bottles off the shelves at a cost of over $100 million. It was one of the largest consumer product recalls in history, and the company's response would later be praised as a model of crisis management. Despite the extensive investigation that followed, which included interviewing hundreds of suspects and exploring numerous theories, the person or persons responsible for the Chicago Tylenol murders were never caught. The case remains unsolved to this day, a chilling reminder of how a seemingly innocent product can be turned into an instrument of death. This tragedy had a profound impact on the pharmaceutical industry and public health policy. In the aftermath, Tylenol introduced tamper-evident packaging, a safety measure that would become standard practice across the industry. The incident also led to changes in federal regulations, including the enactment of new laws aimed at preventing such crimes in the future. The Chicago Tylenol murders remain one of the most notorious unsolved cases in American history, a dark chapter that forever changed the way people think about the safety of over-the-counter medications.